Hello and good morning or afternoon, whatever it is, wherever you are, whenever you might be watching this. My name is Jessica. Got a frog in my throat. My name is Jessica, and I am the world's most productive nurse practitioner. And this is office hours, it's really office half hour, where we're going to kind of talk about the state of affairs in our profession and also some practical tips for helping with your time management, charting efficiency in your visits because no one teaches us this, right? What did you learn in school, right? Drop a comment and let me know. What did you learn in school when it came to charting? And I will tell you what I learned in school. It wasn't zero, but it was pretty freaking close. We learned how to write a soap note. We started in nursing school, actually. So, undergrad, we learned how to do soap notes. And that is a great way, it's a great framework for approaching a visit and approaching documentation, right? Because these are the questions that you need to answer and that anyone who needs to refer to your documentation needs to know, right? Like, so if somebody else takes care of your patient, if you refer the patient out, you need to know, like, subjective, what did they say, right? What was the reason that they even came in? Objective, what did you see, right? Assessment, when you saw these things, what does it mean to you? And a plan, what are you going to do about it, right? So if they're saying that they've been having sinus pain and pressure and a purulent discharge or discolored discharge for 10 days, nasal discharge, and you look and you see swollen turbinates and there's, frontal and maxillary tenderness and their ears aren't looking so good either. And so your assessment is, yeah, I think it's a sinus infection. There might be some like otitis as well. Your plan is antibiotics, Mucinex, fluids, rest, that makes sense. That's what you need, and it's also if they come back then, like, 5 days later and, like, it hurts even more, and you need to look and see, like, what did you see and what did you do? Do you need to change the plan? But if anybody else sees them as well, maybe this is their 3rd ear infection in a year, so you need to send them to ear, nose, and throat, right? Well, they're gonna wanna look at those notes and see what was it that you saw when you saw them, and what was it that you did, and then they're gonna kinda take the ball and run with it from there. So that's a soap note. A soap note is a great approach to the visit and to documenting, to organizing your thoughts as you are communicating what you're documenting. But that's not charting. That's a framework for writing a note. That's what I learned in school. We in grad school, so when I became a nurse practitioner, we took the soap note approach deeper, and there we had to kind of put all kinds of thought into it, which is not a bad thing, right? But it was like I'm trying to remember some of the details 'cause it's been a minute. We definitely had to cite a lot of academic resources, and we had to demonstrate a lot of knowledge through a soap note format of the pathophysiology, right? So if I use that same example of somebody coming in with like nasal congestion, sinus tenderness, and ear pain, we would need to document in that SOAP note, which we turned in as an assignment, why we were choosing antibiotics for this patient, right? And why we weren't just giving them over the counter supportive stuff. Um, right? It has to be more than like a week before we can consider antibiotics. So, like that kind of stuff that you're understanding. So, that would show that you're understanding proper antibiotic use, antibiotic stewardship, the difference between a bacterial versus likely viral infection, timing pieces, what the particulars are for this patient if they're at risk for infection. Things like this. So that was a lot more about showing that you were understanding that you were mastering the information, the clinical information that you were being taught in classes. I get that. Of course, school's going to want to see that, right? So for a nurse practitioner student, it's like a term paper or like a maybe not a term paper, but like an assignment. Makes sense. But when you get into practice, you're not going to write that much and you're not going to be putting like sources and like, APA format. Like that's not what you're doing. So the SOAP note approach is a method for documenting stuff. It's a method for organizing things, but it's also kind of like the S bar, right? Which is a way for communicating things, which you do verbally or written. If you're not familiar with the SBAR mnemonic, it stands for Situation, Background, Assessment, and Recommendation. And it's something that anybody could use. You could use it with the mechanic on the phone, right? If your car is acting weird. Uh, but it's more of like I've seen it more for verbal usage and for giving like a report, like if you're bedside with a patient and they don't look good, they're starting to turn. And so you're calling maybe the physician on call and saying, I think that we might need to increase this med, or can we start the antibiotic now, or whatever the details are. So you're going to give that situation, right? You're going to say why I'm calling, what's going on acutely, the background, right? Like the context, what you're seeing and what you're kind of asking for. So assessment and recommendation. So SBAR is a great mnemonic and it's a great framework for communicating that information. It's efficient, direct, makes sense, it's easy to implement. But that's just a framework, right? So when I talk about charting, yeah, of course I'm talking about writing notes because that's like a big part of what we do. In a typical 8-hour shift in an ambulatory setting, there are kind of like two poles that you're being pulled between all the time, the visit and the note, the visit and the note. You're not ever going to write a note if you don't have a visit, and you can't have a visit without writing a note about it. So those are kind of the back and forth of your entire day. If you see 20 patients in a day, 20 visits, 20 notes. That's the note, okay? That's just the note. But charting is more than that. Charting is everything else. It's the note, but it's also everything else. So it's responding to patient messages, it's responding to staff messages, it is reading referrals, it is sending referrals, it is that reading the report, the post-hospital discharge report that you get, it is doing prior authorizations, all of this other stuff, all of the other keyboard clicking, all the other typing or dictating that you need to do that is beyond just the note to document your visit. That's charting. Renewing a routine prescription that you might do without a visit. That is charting. And that stuff is this very gray, like my scarf, it's this very gray stuff. Doing a visit, black and white. You've got a schedule that is updated all the time, but you have a schedule when you walk in for the day, and that may change through the day, but you've got your slots at 10 o'clock, 10:30, 11 o'clock, 11:30, and you've got Jane Doe, John Doe, Baby Doe, whatever the case may be. And the reason that they're there, that's all clearly outlined, right? And it becomes a historic record too. Like you could look back and see, 2 weeks ago, how many patients did I see? Who did I see? What were the reasons that they came in? Your note is also pretty black and white. Pretty black and white in concept. In reality, can get a little more gray. But that's a pretty black and white thing. I mean, you really just, in the simplest sense, you're documenting what you did in the visit, the reason they came in, what their side of it is, what your side of it is, and what is the path moving forward. But charting is all of this other stuff, and it's not put on the schedule. It can vary in volume. You can have some weeks that are absolutely backed up to the hilt in terms of the amount of stuff that's just showing up in your inbox. And you can have other weeks that are not that bad. I don't want to say lighter, because I don't think that happens, but other weeks that are not so bad. But it's all these other things. And when we talk about charting, it's more than just writing a soap note. That's the tip of the iceberg, really, right? That's the part we can see, and that's the part that we know about. And the soap note, even in writing the note, is not always the best, like most comprehensive, or the best fit, depending on the reason for your note. But charting is much more than writing a soap note. And what we learned in school is typically to write a soap note, right? And the reason that we learn it in school is to demonstrate that we are understanding what we're learning, not so much that we can be efficient, not so much that we can make it easy to access the information in the future by us or by others, but just to kind of prove that we understand when to prescribe antibiotics or whatever the case may be. So school leaves us a little bit in the lurch, right? And you may know that. You may be finding that out, right? Maybe you're in your first job or your second job or your first year or your second year, and it's like dawning on you. Or maybe you're in your first week and it's dawning on you. We all progress at different rates. But you may be coming to realize that there's a pretty big gap. And all this stuff even in a supportive workplace, there's some stuff that is just simply not going to be taught, that you are going to be responsible for learning on your own. And the way that that tends to happen is through trial and error, right? Um, there's not typically like a training day where they're like, Here's how to write a note." Um, I think if you asked for that, you might not wanna ask for that because you might feel like, "Well, they're gonna assume I know what I'm doing, right? And I don't wanna look like I can't handle this," right? So you might not even wanna ask for that help, but you can rest assured if you do it wrong, you're gonna hear about it, right? So they'll tell you that part. And that's kind of what I see, what I've experienced myself, what I've seen my colleagues experience, and what I've seen my coaching clients experience is that when things go wrong, there's all kinds of attention and energy for that. But for building things up in a way that is going to set you off on the right foot and be constructive and productive, that is kind of a gap. And that's kind of putting it mildly. That's where I come in. I definitely work with clients and coaching clients to help with learning these things. It doesn't take forever to learn it, but you do need to be taught, right? Like you do need to have somebody that you can bounce that stuff off of. So it's helpful if you can work with me, you can work with peers or colleagues or former classmates. If you know somebody who's pretty good at this stuff, pick their brain, lean on them for support because doing it alone is tough. It's demoralizing and it's we already have what's called administrative burden, right? There's a lot of, like, stuff that's beyond just what happens in the exam room that we have to do, and that is, like, the number one predictor for burnout. So if you're trying to, tackle all this stuff on your own and not quite knowing, that is exhausting, and it's gonna really set you up for burnout. You're going to be more of a candidate for burnout, and you've spent too much time and too much money to get to this point to then have that be on the radar, like, right off the bat. So that's some food for thought. I want to answer this question, which relates to what we're talking about here, that came to me, and, I like this question. I like all the questions, like, I love having questions sent in. Drop a question in the comments, send me an email, send me a message, whatever the case may be. You can we can I typically do not give people I don't call you out by name because we don't need that. But I love having questions come to me because I love helping people. That's my thing. And I love helping people with this specific subject area. Charting, time efficiency, time management, all that sort of stuff. So the question that came to me, like I said, I like this question. What is the best practice for writing notes? Good question. So like I said earlier, the SOAP note framework is good for taking notes. When I'm in a visit with a patient, I'm using a clipboard and paper. So sometimes I have used templates. Sometimes I've used in a kind of like worst case scenario, I'll just use a scrap of paper, right? And you put like the patient initials or the time of the visit so you know who it goes with. But I like to write it down on hard copy because that's me. I'm a pen and paper person, but also there's things are never like sequential. Right. So, like, you're doing your subjective, okay, they're telling you kind of what's been going on. You ask them some questions and you do your exam, and then like something comes up. Or in the course of the exam, you realize, oh, this is a little bit of a wrinkle. And so then you ask them some more, like, how long has this been going on? So it's nice for me to be able to have the pen and paper and to be able to kind of have that flexibility from documentation. And then assessment and plan, right? And you send the patient on their way knowing what the plan is. I'm going to send a prescription to your pharmacy or whatever the case is. Um, but that is for the visit, the SOAP approach, and I like it for the visit. I also like to use old cards. If you're not familiar with that mnemonic, you probably are, but in case you're not, it stands for onset, location, duration, characteristics, aggravating or remitting factors. So what makes it worse, what makes it better, timing, and severity. Old cards. You can also look it up, Google it. That is a good one for, like, acute issues, right? So if somebody comes in and, like, their knee is hurting or something, or my husband was saying his foot was throbbing. Okay, well, that can mean a few different things, right? So you can throw the old carts in there and kind of get a sense for what's going on. Is this something that happened? Is this an acute injury, or is this something that's chronic but getting worse? So you can throw that in there too. But when it comes to writing the notes, here's my thing. Don't overdo it. Do not overdo it. You are making it harder on yourself to write the note, right? It's going to take more time. You're making it harder on yourself when you have to refer back to that note. So if you're seeing the patient for follow up, or if it's their annual physical, and so you next year you want to look at last year's physical, that kind of thing. You're making it harder on yourself when you have to read the note. You're making it harder on other people who have to read the note. So if somebody needs to refer to somebody's covering for you, right? And you're on vacation or something, and somebody's covering for you, and the patient comes back in and they need to look at that last note. If they had to go through all this stuff and pick it out, you're making it harder on them. If the patient ends up in the emergency room, God forbid, right? Then you want them to be able to find the information from your note really quick, right? So that they can take the best care of the patient. Um, so don't overdo it. And here's my approach for not overdoing it. So this is really kind of has nothing to do with soap or old carts or anything like that. It's really about your approach to the note. So if you want to write it as a soap note, you can do that. As long as you're covering your bases and you're not leaving something important out, like don't do that either. But don't reinvent the wheel every single time. So I have templates. I have 4 templates that I use for like 95% of my visits. Almost every single visit, these templates are what I use. And they're simple, right? And it's kind of fill in the blanks because there's some stuff that is going to be the verbiage is going to be the same for every visit. Like I can't think of a time when I wouldn't. So every note that I write starts with so and so, whoever the patient is, and that's going to get automatically pulled in by your charting system, so you don't have to put that in there. But so and so presents with concern for blank. Every visit starts that way, unless it's an annual physical, and then it's presents for annual physical. But there's verbiage that is going to be exactly the same in every note. You don't have to write that every time. Put that in a template. Put that in a smart phrase if your charting system allows that. Um, at the end of every every note, I think, 95% of them, but pretty much every note I write, one of the last things that I write is advise patient, if symptoms worsen, it's in so many of the notes, I don't even actually write it because it's just baked in there. But if any symptoms worsen or if any new or concerning symptoms develop, return to office or emergency precautions. If that's, I might adjust that a little bit. But I'm putting that in every note. But I'm not writing it every time. As you can see, I don't recall the exact language. I'd have to look at one of my notes. But because you're being consistent there, that's something that you're gonna tell every single patient. You're always going to be advising them, like, when they should be concerned in coming back or when they should be concerned in going to, like, the emergency room or urgent care. Um, you're gonna document that every time, but you don't need to write that every time, okay? So that's what I'm talking about with approach. Um, so the 4 templates I have a template for an acute visit. So that's somebody who has sprained their ankle. I have a template for follow-up visit. So that is going to maybe be my 3-month diabetes follow-up or my hypertension follow-up or a 1-week cellulitis follow-up, right? I have an annual physical and I have a pre-op physical. The pre-op physical, sometimes you get into a lot of detail, right, depending what they're having for surgery. If they're just having cataract surgery, that's a pretty quick one. But if they're having like a hip replacement, that's a pretty intense visit. So that's its own template. But again, I go through the template because a lot of the stuff that gets written in there, you just need to fill in the blanks. Like if you're doing the Malampati assessment to look at their airway, you don't have to write all the verbiage in there. You just need to put like what their criteria is, what their score is. If you're doing the um, sleep apnea, right? Stop bang. If you're doing that assessment, you need to put the score. You don't need to put all the verbiage in there because the verbiage is going to be the same every single freaking time. It's just the score that's going to be different. So looking for ways that you can put as much on autopilot as you can It's going to save you so much time, and it's going to save you, like, mental bandwidth. You can use that energy that you saved by not having to document this way and put that toward better use, like getting some of your other charting done, right? Doing some of your lab results and getting those just off your plate until more come in. So templates, 4 templates that I use, and this is in a primary care setting, so depending, if you work in, like, ophthalmology or ear, nose, and throat or something, you might have a slight difference on that. But conceptually, you're going to have the same thing because there are going to be some patients that you see, some types of visits that you see all the time, your bread and butter visits. What are your bread and butter visits? Take a classic note from that and look at all of the stuff that would go in every single note for that visit. Take out the stuff that's specific to that patient, and then what's left behind, that's your template. Right? And then create a template. So however your system creates it, if you don't know how to create it and you have to have like IT help you with that and you don't have time for that, you can put it in a Word document and you can have that live on your desktop and you can copy and paste it every time and then just fill in the blanks. And it's still going to save you so much time. If you have the templates just available in your charting system, that's even faster. But even that copy and pasting from like a Word document or Google document, that's not patient information, that's just the template, that's just the framework, and, it's gonna make it so much faster for you, right? It really is. I'll put a link in the, below. I have a 4-pack of templates that are the ones that I use, they're fully customizable. If you wanna grab those, you can do that, or you can create your own. I mean, there's not, like, one right way to do it, it's what's right for you, but again, it's about these approaches. It's about the philosophy, it's about the concept. It's not about which template is best because that depends on the user, right? I can tell you what works for me, and it might work for you, or you can adjust it so that it does work for you. But it's about finding those ways to be adaptable and to look big picture, not through such a narrow lens, but big picture. What are we doing here? What are the big buttons that we can flip or switches we can flip? When you press a button, flip a switch. What are the big moves we can make that are gonna have, like, a high yield? So looking at your visits, deciding what your bread and butter visits are in a primary care setting. I do a lot of follow-up visits, right? So having a template for follow-up makes total sense because half of my visits are gonna be follow-up, right? New patient visit, I just basically use the, annual physical, and then I just customize that, right? Because it's still gonna cover all my bases. I don't see a ton of new patients, I see more follow-up than new patients. Your mileage may vary, but you're still going to use that same conceptual approach. So the best practice for writing notes is to have a template so that what you are writing, and I dictate, by the way, but what you are writing is really just what is specific to that patient. So I mentioned my husband said his foot was throbbing, right? So if he was your patient and you were seeing him, you are going to put the particulars in, right? You're going to put the particulars of, what the old carts of his foot throbbing and all this kind of thing is. Does he have gout? No, he pulled his fascia, but what are the old carts of that situation? What are the other diagnoses that might make a difference? If he has asthma, then you include it, sure, right? But the problem list is going to automatically important to the note, so you don't really need to call that out. Asthma, that's not really relevant. But if he had arthritis, that could be relevant, right? If he had bunions, right? And so his foot is throbbing, that could be relevant. But if he has asthma, you don't need to like specifically highlight that. It's going to come up in the problem list. So it's going to be in the note, right? You don't need to mention it again. So using templates, and not a lot of templates either. Get like 3 or 4. The pre-op ones, I don't use that often. It's probably the 3 of the 4 that I use the most often. And the follow-up visit is easily, off the top of my head, 50+% of what I do. So look at your schedule. Pull your schedule. Excuse me. Look at your schedule for the last month, last 4 weeks that you worked, and see what are you seeing the most of, and then pick one to start and create a template. Take one note that was a classic note and look at that, pull out all the stuff that is not specific to the patient that you would conceivably ask 90% of your patients. Put that in a template and start using it. And then just fill in the stuff that's unique to that patient. It's going to make it faster. It's going to free up emotional, mental, excuse me, bandwidth for you. And I think that that's a best practice for writing notes. If you want my templates, you can click below and you can grab those. You can easily create your own. You can go either way. The point is that you're looking at these big picture factors and using them, pulling that information and using it in a way that's going to benefit you and make your life easier and not harder, right? How about we learn that stuff on the job? Let's learn how to make our lives easier, okay? So until next time, take care.